How you doing? My name is Tom Willman, a physical therapist. I'm from Apex Orthopedic Rehabilitation in Wyckoff, New Jersey, just in North Jersey here. I'm going to talk about upper back and mid back pain, stiffness, anything you're having, any discomfort, achiness in the thoracic region today. At the end of our video, we're going to show you 3 stretches that you can work on to really kind of loosen up this area and make you feel a little bit better with a variety of things, whether it be sitting, or your sports, or any activity you enjoy doing. Now, a lot of people will experience pain in this thoracic region. So we have the cervical region, which is C1, 2, 3, and you can number the vertebrae all the way down. There's 7 vertebrae in the cervical spine. In the thoracic spine, we have 12. And this lower area is called the lumbar spine. There's 5 vertebrae there, okay? So that's basically it. So we're going to be looking at rotation for our stretches today and extension. Those 2 movements capture a lot of what we lose. Oftentimes I see in the clinic, a lot of us lose this ability, okay, because we're sitting a lot. A lot of our time we're sedentary. We're kind of hunched over our devices or our computer. And we also lose a little rotation too. That's part of that motion. So we're going to give you stretches for those 2 directions. Now, one thing to consider here, if you're having mid-back pain, and you don't even have neck pain, just have mid-back pain area or upper thoracic pain, is that sometimes that area, between your shoulder blades, is an area that's actually pain that's emanating from the cervical spine, this area, okay? And stretches for the thoracic don't really do much, okay? So one way we like to do is we want to consider that occasionally we might be dealing with a neck issue that's giving us pain in the thoracic. So we'd like to kind of look at the cervical spine, move it around a little bit, and see if it gives us pain in this area. So we move this up in the cervical spine, and if it reproduces the same pain that we're getting in the thoracic, it tells us this is actually a neck issue that's giving us pain in there. Similar to when we have a heart attack, or we're having heart problems, and we get jaw pain or arm pain, okay? So the absence of neck pain doesn't mean that the pain isn't coming from the neck. Okay, so we're going to do a little assessment of the neck first to make sure. Okay, so one thing we're going to do, how we self-assess the cervical spine, we're going to sit up nice and tall. The first movement we're going to do is rotation. So we want to bring our chin close to over our shoulder here. Okay, so for normal cervical range of motion, we may have, everyone varies a little bit. We want to get close to our chin, almost going over our shoulder. We want to make sure when we're checking that, we're not moving our whole body. So we want to rotate over. I guess we're almost close to there. That's pretty good motion. Same thing to the left. If any of those movements reproduce pain in that area, obviously that's a sign that we're moving the neck, we're getting upper back pain. This is really a neck issue. The other direction we're going to look in is cervical retraction, kind of pulling in like a chin tuck, they'll call it, and extension. What we want to see with this is we want to see in a perfect world, okay, a lot of us should, when we have good range of motion, our chin and our forehead should be almost parallel. I think I'm close, but we want to look almost parallel to the ceiling or the floor. We want to bring this about like so, if we have adequate range of motion. Everyone varies a little bit, okay? So we do that motion. Let's say both of those motions were fine. They might have been tight, but they didn't reproduce the pain. So to really be sure, we have you do the rotation 10 times this way. Maybe you can give a little pressure with your hand. Then check 10 times this way. And then 10 times retraction with extension. After you do 10 times in all those directions, if it doesn't make the pain better, or if it makes the pain better or it makes the pain worse, either way, it tells us we're dealing with a neck issue most likely, okay? So try those directions, do 10 times cervical retraction and extension, and then rotation, 10 and 10. Still don't have anything in the thoracic, nothing changes as far as that pain in the thoracic, then we're probably dealing with just a thoracic issue. Good, that's great. So then we move on to looking at our thoracic motion, okay? So a good way to self-assess this is you can sit in a chair or even on the floor, kind of keep your hips locked. Good chairs if you have a chair with like armrests here. And you're essentially going to go into thoracic rotation here to either direction. And then you're going to lean back and try and get into a little thoracic extension. If you can't get past neutral, like a lot of our folks, neutral meaning like this is me upright, this is neutral, and you really can't go past this point, that's an indication that you're losing some thoracic extension. If you can't get, if this is 0 degrees, like straight ahead, put my hands and I turn my body with my head to here, I should get to about 45 degrees on each side. If I'm restricted there, that tells us we also have a loss of motion there and tells us there's probably something we can work on. When in doubt, it's hard to self-assess the thoracic spine. I would just stick with the 3 stretches I give you as long as it doesn't make your condition worse. If you're interested in a personalized one-on-one evaluation, consider doing a telehealth call with us or coming down to our clinic in Wyckoff, New Jersey. We'd love to meet you and give you an individualized, personalized plan. So remember, when you're doing these thoracic stretches that we're giving you, it should never make your condition worse. Okay? You should do it slowly, gradually. If you're ever unsure, you should really get a clearance from your doctor or therapist before we do these stretches. These stretches should provide some pressure. You should feel a little soreness, but nothing that lasts more than a couple minutes after stopping them. Okay? So here are the 3 stretches you should do. Okay, so the first stretch we're going to show was a thoracic rotation. Okay, the first thing we want to do is we want to sit up nice and tall in the chair here that we're in. I like this chair because I lock my legs, I push my legs against the armrest here because I don't want any motion from my hips. I'm trying to get everything from kind of the waist up. Okay, so I take my hands like so. I would do 10 repetitions to either side. I kind of like to do 1 in one direction and 1 in the other. If you notice one side is a little tighter than the other, I would emphasize that side, the side that's restricted more than anything. Okay? So arms like so. You want to feel like the motion is occurring from here, not from just moving your arms. So lock these arms in like so. You want to turn your head as you rotate. Okay? So you want to turn your head and your thoracic like that. Hold 1, 2, and then come back to place like this. Okay? So all the way over. 1, 2. You're going to get to the very end of the motion. And then back. Same thing the opposite direction. Remember, nice and upright. Lock your hips in. All the way over. 1, 2, and then back. You can increase the time that you're actually stretching as you do the stretch and you feel like it's a positive stretch, but you can hold it for maybe 5 or 10 seconds, okay? We want to do this at least 10 times. And in the clinic, I'll tell people to do this 10 times every 2 hours. So it's about 5 sessions a day, but you're just doing this stretch, these 3 stretches. And then you're going to do this over a week. If it doesn't change your condition, you may need an evaluation, okay? But those are the things. Now also with thoracic rotation, the thoracic, since it's got such interconnection, it's all the connections to the rib, it's kind of hard to move, okay? It's very rigid, okay? So sometimes if we've done these stretches, we've done these holds for 1 or 2 seconds, to add a little bit more force, we'll do a little bit of a whip. We'll just come at the end and just give a little 1, 2, get a little bit more motion into the end range. 1, 2. Same thing the other way. 1, 2. A little bit of that bounce, a little extra pressure, especially because it's so rigid and the thoracic is much tighter than the cervical and the lumbar spine. So sometimes you need a little bit more force for you to have a change in how you feel. Okay? Next what we're going to do is we're going to do a sitting one for extension. Okay? Extension is just leaning backwards. So we're going to sit like so, and we want to be as upright as we can. This chair is perfect because it's just cupping my back. It's getting me right in the kind of lower thoracic here. I like this roll, especially if I'm trying to get a little bit higher in the thoracic spine. So I create a little fulcrum point. So I'm going to take your hands like so. You're going to lean back like this until you feel a little stretch. Sometimes we add a little breath through our nose to expand our rib cage. Breathe out. 1, 2. And then back up. When we get the breath in, that expansion of the rib cage, since the ribs attach, it opens up, it increases the volume of the thoracic, like it expands the ribs. That actually does a little stretch in the thoracic, kind of adds a little bit to it. So all the way back again. Breathe in. Breathe out. 1, 2. Same idea. We're going to do 10 in that direction, okay? Should never make you feel worse, okay? Keep your feet on the ground, and we really want the motion occurring from above the roll. The last one is a prone press-up. It's commonly associated with the lower lumbar spine, but it also especially stretches the lower thoracic spine, lower and mid-thoracic spine, depending on how you're doing it, okay? Same idea, 10 to 20 times every 2 hours for it's about 5 sessions a day. Do it for a week, see if there's a change. If not, you might need an evaluation if it's really something serious. Just a little bit of mild stiffness, then you can work on it longer. Remember, none of these stretches should make it feel worse. So you're going to lie like so. Spread your legs a little wider, hands right to the side of your shoulder. You're going to press up. You can do that same breath I talked about. Breathe in. Breathe out. And really want to like let your hips sink and your lower back sink in. 1, 2, and then back down. To get a little bit more motion, I'll have people place a roll like so, and they're going to push up from the roll. Okay? And now at the very end of my motion, I'm getting a little bit more motion in the thoracic spine. I can feel it a little higher up into my mid-back area. And then back down. Okay? Depending on how mobile you are, certain people need more motion, especially people like dancers or people that are a little bit more hyper-flexible. So consider that. So good luck with these exercises. I hope it kind of improves how you feel and how you move. If you really enjoy this videos, please subscribe, like it, and share it with people, or make a comment. We'd love to have any questions, all right? Any other things as far as contact information, just check us in the description below, and you'll be able to link to our website for more information about how to get treated by me. And have a wonderful day.